Dermal fillers really help people as we age. We tend to lose a lot of volume in our face, and so we develop some very deep lines around the nose and the mouth. And the dermal filler helps to plump up that area and fill that area in. It's a relatively simple procedure. It takes about 10 or 15 minutes. We do it right here in the office. Very tolerable, very little downtime. Certainly is not going to be the same degree of bruising and such as something like a surgical procedure or facelift. So really a pretty simple procedure, but can make quite a difference in how they look and obviously how they feel about themselves.
Well, the first thing that I liked about it was a procedure that I could book easily with the office. I knew Dr. White well and her staff and had been a patient of hers before, so they readily made the appointment for me to come in, and it's done right here in her office, made it easy for location-wise. We didn't need any sort of painkiller for the procedure at all. I considered it totally painless. It took a relatively very short period of time.
The product we're using today is Radiesse, and it's a calcium hydroxyl apatite filler. So it's a little bit different than some of the other fillers that are hyaluronic acid fillers. And this filler lasts sometimes a little bit longer than the other fillers. It also helps for generation of the patient's own collagen. So it helps over time you build up a little bit of collagen on your own. Generally, the procedure will last about 9 to 12 months. Oftentimes, if patients will come back in about 4 months and get a touch-up on it, it can even last up to 18 months. Most people are very pleased with it and really love it. They're very happy with it. They generally think it makes them look more youthful, oftentimes a little more rested, so most of the time patients are very pleased with it.
It's nothing that looks fake, phony, or stiff. You walk out and your lines have just disappeared. The reason I would definitely recommend it is not only painless, quick, there's no downtime whatsoever, and you walk out with minimal anything. I had very little swelling in my face. I had the procedure done at 2 in the afternoon. I was out at a restaurant dining that night at 7:30 and nobody knew the difference, except me.
Dr. Catherine White has been using a new procedure that may help in the early detection of women at risk for breast cancer.
The Halo is a new test. We've been doing it now for a little bit over 2 years, and it's a test to help us determine which patients are at risk of developing breast cancer. We know that 70 to 80% of patients who get breast cancer have no family history and no significant risk factors. So our challenge as physicians is how do we figure out which patients are at risk. And this is really the first test that helps us do that.
For women 25 years or older, the new FDA-approved Halo Breast Pap test can find abnormal breast cells many years before they might become a cancerous lesion.
Well, I think that's the most important part is hopefully it will give you information that if you are at a higher risk, that you can get the treatment that you will need early, and that breast cancer doesn't progress into a later stage in which the statistics on saving your life decline.
The Halo looks kind of like a breast pump. It has 2 cups that fit over the breast. It kneads the breast tissue and creates a little bit of warmth and suction, and then tries to elicit some fluid from the ductal system. So any fluid that's collected, we just get a little bit out of the cup on a Q-tip, and then we'll go ahead and place that in a vial. And then this specimen goes to the lab and is processed similar to how a cervical pap smear would be, looking for any abnormal cells. And it's really the only tool that we have to do that that's not an invasive procedure like a breast biopsy. By the time you see something on mammography, it's been there for 5 to 8 years already. So we would like to modify a woman's risk before you can find something on mammography and really pick something up a lot earlier if there's a problem going on.
It took 5 minutes at my normal doctor's visit, and it was relatively inexpensive.
There is some mild discomfort associated with the procedure, but most patients said it's not as bad as even having a mammogram done. And it is recommended as a yearly screening test, so generally we'll incorporate it just with our annual visit for women and make that a part of their regular annual exam.
Once I got my results, I had peace of mind because I knew I was not at a higher risk of developing breast cancer. And any information that we can get and use to combat breast cancer is very important.
Dysport is comparable to Botox. They both actually work very well, but sometimes certain areas may respond better to Dysport. Often I found in the crow's feet area in particular, Dysport seems to do a little bit better because it spreads more.
I decided to have Dysport done because I had noticed lots of tiny little lines around my eye area, and I had come down and consulted with Dr. White what could be done to kind of brighten up my eyes. My eyes are very small, and she decided to inform me on Dysport, and we went ahead and did some injections, and I absolutely love it.
Well, both of these procedures are FDA approved for the frown lines and what we call the glabella, but they can also be used for forehead lines, they can be used for crow's feet. There's some advanced injection techniques around the mouth that you can do, but it's primarily the upper face for people who are having wrinkling and want to get rid of that.
I would recommend this to others because I have so many people that have come up to me and said that they have noticed a big difference. I don't look tired anymore, my eyes seem a lot bigger, and I look a lot younger, and I absolutely love it. It had no side effects, it was easy, done in 2 minutes, and I saw the transformation in 2 to 3 days.
I've been very pleased with the results. Most of my patients have been very pleased with the results. You know, you can occasionally need to add a little bit more, and I usually like to start my patients kind of light to begin with because we can always add more to it, but we obviously can't take it away. You know, the odds that they're going to have any serious side effects related to it or be extremely unhappy with it are pretty small. You know, occasionally you might need to tweak something or change it a little bit the next time that you inject them, but you know, most patients are very pleased with the results.
Dr. White is absolutely one of the most wonderful doctors. She's very caring, her staff is very caring, and she's very knowledgeable on the products that are out on the market that can help you, and I'm very pleased with what she's done.
The rapid onset, I think, is a definite benefit because a lot of people will kind of wait till the last minute and come in and say, I've got something I need to look great for in 3 or 4 days. So you're going to get, start to get some decent benefit out of the Dysport in a fairly short period of time.